All right, guys, we now actually have Representative Michele Bachmann joining us from Washington, D.C. Representative, thanks for joining us. It's Cody here to start with you. And as we mentioned here earlier, we had a congressman on yesterday talking about that we already have exemptions, apparently, for Aetna and the other large insurance companies. And rather than simply enforcing the laws that are on the books, it seems you guys are dead set on writing 1,200 pages worth of new laws, basically from the lobbyists of the same companies that are supposed to be busted apart in the current laws that are on the books. Can you address that at all?
There's lobbyists running up and down these halls right now because there's a lot at stake. One thing government does really well is establish cartels and enforce them. And so that's what we have to be concerned about government coming in and taking over where you have private companies. We don't have a perfect system now, but it's a great sight better than having the government come in and take over health care and run it.
I guess, Representative, what I'm saying, though, is you're not even enforcing the system that's in the books right now. The Aetna is not allowed to be as big as it is. It has too much market share. It's illegal. It's antitrust. You guys just simply need to have the Department of Justice come through and enforce the law.
Enforcing the law is a good thing. I agree. That's a great thing. We should have hearings.
Amen. Call for them, please.
Well, let me back this up with you, Congresswoman. Thank you for joining us. What about just eliminating the portability of health care? In other words, rather than spending $1 trillion or whatever it ends up being, by the way, I don't buy the CBO $900 billion. Let's take $900 billion. Rather than spending $900 billion, how about allowing a guy who lives in New Jersey to buy health care in Pennsylvania because it's cheaper there? It's a border state. I can't do it, though. Doesn't that make more sense? Doesn't that create the competition that they're trying to do artificially by creating a public option?
That's exactly the answer that we need to go with. It's the idea of the fact that any American go online and buy their car insurance. Why can't any American go online and buy their health care insurance across state lines in associated health care plans where people come together in groups and buy their plans? And I have the Health Care Freedom of Choice Act that would allow full deductibility of your health care expenses. That plus making health savings accounts far easier. Then we move toward freedom, individual ownership, and away from this top-down government owning everything where people will get care but pay more.
Look, Kirsten, how about that? Do the Democrats support something like that? And if so, and if something like this were to happen, could we afford it, though? I mean, sure, we can afford car insurance, and we can insure, afford homeowners insurance, but health insurance is a whole different ballgame where you're talking about, hey, what about if I need heart transplant or chemotherapy? Is that insurance going to be affordable that I can buy it on my own without my employer kicking in most of the cost, the coverage?
Rebecca, take one step back and consider if everyone felt that way, that if they go into the government system, they'd be consuming more than what they're putting in. This calculus won't work. Someone has to pay the bill. And at the end of the day, everyone needs to be responsible. This current health care bill that the Democrats have put forward is more about irresponsibility than responsibility. Okay. Americans are really good people, responsible people. We can trust the American people to make good economic decisions. This is about your body, your health. People will make good decisions. Can they afford it? Yes, they can.